Hi everyone, my name is Britte'Nee and I'm from Ann Arbor, Michigan. Even though I live in Ann Arbor currently and I did grow up in Ann Arbor public school system, I did go to Michigan State University. I'm proud to be a Spartan though, and I graduated from MSU in 2012 with a Bachelor's of Science in Interdisciplinary Health Studies. So Michigan State actually does not offer a Bachelor's in Public Health, but that was kind of a degree that also perked my interest and was close enough. I got to take epidemiology and things like that. I currently work at a federally qualified health center in Detroit, or an FQHC, which means that we receive money from the federal government to provide services to everyone, regardless of their ability to pay. So we especially serve the Medicaid population, the Medicare population, and those who do not have insurance, whether they be undocumented or for other reasons. At the FQHC, I currently am the program manager, and in that role, I do a variety of things. It's kind of vague. My primary role is serving as the Health Homes Coordinator for a program that is called the My Care Team program. And this program is a pilot program in the state of Michigan to hopefully prove that community health workers, or CHWs, can be beneficial in reducing ED utilization in the Medicaid population. So people who are participating in the My Care Team have Medicaid, and they get to work with a community health worker to address the social determinants of health. Typically, a doctor's office only addresses medical needs and not necessarily other things that are going on in a patient's life. So working with that team, I do reporting to the state on outcomes, and I also schedule programs, so maybe mindfulness to reduce anxiety, or nutrition education, or cooking classes for our diabetic patients. I enjoy it a lot, but I'm actually in the middle of a transition where I will also be a program manager, but for AHEC, which is actually the Area Health Education Center, and I will serve as a program manager for Southeast Michigan. In that role, this is perfect timing. I actually will have to conduct community needs assessments for a few counties in the area, and I actually have no experience in conducting community needs assessment, so this is perfect timing, and I look forward to getting experience in that area for my next job, and I know it'll be useful in the future. When thinking about where I would want to conduct a community assessment, I currently work at an FQHC with multiple locations throughout Detroit. And for those of you who don't know, Detroit is a huge city, going through some struggles right now, but a great city. And a lot of the areas have a very different feel to them. I currently work in Southwest Detroit, which hosts Mexican Town. So we have a lot of undocumented patients. And while we are great at finding resources for our patients, some barriers that we come to face with our patients are due to their documentation status, or because of language barriers. So I think conducting a needs assessment in Southwest Detroit would be a great option. Another area I am interested in conducting a community needs assessment is in Cody Rouge, Detroit, which has a population of around 37,000. My mom actually grew up in that area. My parents are from Detroit, and it's actually a very rundown part of Detroit. Whereas, you hear about downtown Detroit coming back. Southwest Detroit is actually pretty close to downtown Detroit, and a lot of the economic revival can trickle down towards Southwest, whereas it's taking a little bit longer to get to the Cody Rouge neighborhood. And our organization is actually looking to break ground on a 20,000 square foot health center, which would include medical, behavioral, dental services in that area. And I would really be interested in learning more about what that community needs and how we can best serve them. And I look forward to working with you all and hearing about the communities that you'll be assessing and what we can all bring to this class to learn from each other. Thank you.